Your MD Anderson Cancer Center care team is here to support you as you prepare for your neck dissection. Cancers of the head and neck can drain into lymph nodes in the neck. A neck dissection is a surgery to remove lymph nodes from the neck that may have cancer. The procedure also helps your care team plan for more treatments if needed. Your care team includes members of the surgery staff who all work together to create your personal care plan. This may include speech-language pathologists, radiation and medical oncologists, radiologists, pathologists, nurses, and many others. You may need radiation, chemotherapy, or other cancer treatment in addition to the neck dissection. This will depend on the kind of cancer and results from your pathology report, which is usually ready about a week after surgery. With a neck dissection, you are usually in the hospital overnight. You may be able to leave the next day if you are feeling well, can eat, drink, and urinate. Everyone recovers at different rates, and it's important to give yourself time to rest. You may have lower energy levels in the first couple of weeks after surgery. Allow others to take care of you. Expect to have some temporary throat discomfort when you wake up from surgery. Your voice may also sound hoarse. This is from having a breathing tube in your mouth and windpipe during surgery. There may be some swelling, mild redness, or puffiness around the incision, and you may have stiffness, numbness, and soreness of your neck. Many of these symptoms may last for several weeks, but will improve with time. If you develop new pain, increased swelling, or have increased redness at the incision, tell your care team. Some patients may develop a seroma or hematoma in the neck area. A seroma is fluid that can collect under the skin in the area of surgery. A hematoma can happen when a larger amount of blood collects under the skin. If you are not sure if you have a seroma or hematoma, call the clinic during business hours. After hours, call Ask MD Anderson so they can decide if you need to go to the clinic, the acute cancer care center, or the nearest emergency center. Some people find it more comfortable sleeping with a few pillows under their head for their first few nights after surgery. The care team recommends that you sleep with your head propped up at least 30 degrees to reduce swelling. You may have surgical tape or surgical glue over your incision. It is okay to let it fall off on its own. Dissolvable stitches may also be used. They do not need to be removed. They will get absorbed by your body. You can start showering again 24 to 48 hours after your surgery, but just let water run over your incision. Do not submerge the incision under water. You will be discharged from the hospital with a drain, and the nurses will teach you how to care for it. You will also learn how to measure your fluid output 2 times a day with a measuring cup provided by the care team. You can return to clinic to have your drain removed once the fluid amount within a 24-hour period is low enough, usually less than 30 milliliters or cubic centimeters. You will receive discharge instructions with this information. The care team may also give you a prescription for a small amount of pain medicine. The goal is to make you as comfortable as possible, but you will still have some pain. Most patients can control pain with over-the-counter medicine, such as acetaminophen or ibuprofen. Be sure to follow your doctor's instructions on how and when to take your pain medicine. If you have additional pain, your doctor may prescribe you a stronger pain medicine. If your pain does not get better with medicine, tell your care team. Most patients start with a clear liquid diet and advance their diet as tolerated. Your care team may refer you to a speech-language pathologist if your cancer treatment has affected your swallow function. If you have concerns about problems with swallowing, talk with your care team. Start stretching slowly and gently the day after surgery. Walk a little more each day. This helps with the healing process. Do not drive until you are no longer taking prescribed pain medicines and can quickly turn your head both ways. Do not lift anything heavier than a gallon of milk or 5 pounds, and do not do any strenuous activity, such as heavy housework, until approved by your care team. Recovery from surgery may take up to 2 weeks or longer. If you work at a job that requires physical exertion and long hours without rest, you may need longer leave. Be sure to tell your care team about the type of work you do. All surgeries have some risks, but the risks of having problems from a neck dissection are low. Possible problems may include shoulder weakness. There is a nerve in the surgery area that helps move your shoulder. Even though your surgeon is very careful, you may still have pain or weakness. This may cause problems shrugging your shoulders or raising your hands over your head. Shoulder weakness is usually temporary. While the nerve is recovering, it is important to do shoulder exercises. Physical therapy helps with your shoulder's range of motion. Even when the nerve is healthy, the care team recommends exercises to maintain good shoulder function. A physical or occupational therapist may see you before you are discharged to show you how to do these exercises. If the small branch of the facial nerve in your neck is affected, you may also have lower lip weakness. Nerve weakness may lead to an uneven smile or, in very few cases, drooling. The weakness is usually temporary and should get better in 3 to 6 months, but can take up to 1 year. Tongue weakness or numbness could happen, but this is not very common. Your care team will talk with you more about this if it's a concern. Another possible problem is a chyle leak. Chyle is a milky fluid made in the gut when fat is digested. It is carried in lymphatic vessels that empty into small channels in your neck. It may cause problems with wound healing and nutrition, but it can usually be treated with a fat-free diet. If you see milky fluid in your neck drain, tell your care team. They will help decide the next steps of care. Your care team will schedule a follow-up appointment after you are discharged from the hospital. If you have stitches that do not dissolve, your care team will remove them about 7 to 10 days after surgery. They'll also review the outcome of the surgery and plan other treatment if needed. Call your care team right away if you have increasing or abnormal swelling, pain, or tenderness at or near the incision. Some swelling is normal. Increasing or abnormal redness, changing color, or warmth at or near your incision site. The skin separates at the incision. Increasing or abnormal drainage or drainage with pus. A foul smell from the incision. A fever of 100.4 degrees Fahrenheit, 38 degrees Celsius, or higher. After business hours, call Ask MD Anderson. For more information, refer to the patient education sheet on neck dissection. Talk with your care team if you have any questions.